సో ఎవ్రీ టైమ్ నేను వీళ్ళందరికీ చెప్తున్నా ప్రతిసారి ఇంట్రెస్టింగ్ టాపిక్ అని.
Yeah.
సో అందరూ డాక్టర్ అవ్వబోతున్నారు. సో అసలు ఒక డాక్టర్ ఎందుకు అవ్వాలనుకుంటున్నారు, డాక్టర్ అయిన తర్వాత వాళ్ళ కర్తవ్యం ఏంటి, సో నెక్స్ట్ వాళ్ళు చేయాల్సింది ఏంటి, అసలు డాక్టర్కు ఉండాల్సిన మినిమం లక్షణాలు ఏంటి, ఇలాంటివన్నీ ఇప్పుడు మనం ఈ డిస్కషన్లో తెలుసుకోబోతున్నాము. సో కొంచెం ఇంట్రెస్టింగ్గా వాచ్ చేయండి. అండ్ డాక్టర్ గారు మిమ్మల్ని క్వశ్చన్స్ కూడా అడుగుతారంట, సో రెడీగా ఉండండి. ఇందాక దాకా నేను అడిగాను మీకు ఏమన్నా డౌట్స్ ఉన్నాయా అని, సో లేదు డాక్టర్ గారు అడుగుతారంట. సార్ అసలు ఫస్ట్ ఆఫ్ ఆల్ మీ ఇంట్రడక్షన్ చెప్పండి సార్, మీరేం చేస్తున్నారు అసలు వీళ్ళకి తెలియాలని, జస్ట్ అంతే.
సో అంటే నేను ఇంతకుముందు స్పీకర్స్ లాగా నేను వన్ వే టాక్ ఇవ్వను, బికాజ్ ఐఎమ్ ఆల్సో ప్రొఫెసర్ ఆఫ్ నెఫ్రాలజీ, ఐఎమ్ ఆల్సో టీచర్. సో ఐ విల్ ట్రై టు ఎంగేజ్ యూ, ఆల్ ఆఫ్ యూ. I am Dr. Gangadhar, professor and head of the unit of nephrology in Nizam Institute of Medical Sciences. And apart from being a doctor, I was also a policy maker kind of a thing, where I involved in the policy making of the state health for last 10 years. I think Ramani madam knows about our contribution. We worked as a team at that time. So my journey, I started like way back in 1991 in Gandhi Medical College. I graduated from Gandhi Medical College and then I did my PG in internal medicine in Nizam Institute of Medical Sciences. Then I went to do DM nephrology in Nizam Institute of Medical Sciences only. Then 2 years I went to Harvard for doing a postdoc fellowship. So a lot of questions were there on doing research. Lot of questions are there. What, like last speaker also ended, that we should be serving the people. So as a doctor, you also in the statement in the beginning you told what is the role of a doctor in the society. So నేను కొంతమంది క్వశ్చన్ అడుగుతాను, ఎందుకు డాక్టర్ అవుతున్నారు అని చెప్పి. I think I asked the question, doctor in the back, I think
మైక్ ఇస్తారా స్టూడెంట్స్?
yeah, mic ఇచ్చి why you want to become a doctor. I just want to have an interactive session rather than a general session like that. Why you want to become a doctor?
Give them mic.
The topic given to me by the organizer, Health for All. The topic you are also seeing, it's Health for All. What do you mean by that? So, to make the society having health for everyone, what is the role of a doctor? So, first of all, I'll ask you, why you want to become a doctor?
Sir, this is like based on my personal experience.
Yeah.
25 years back, one person who helped everyone in his village died just because of a cut on his hand while he was in agriculture.
Yeah.
And the reason being, the one medical officer who was supposed to be there was not there. Why? Because he completed his duty of 8, instead of 8, 12 hours duty, because healthcare professionals are not there, first of all. And second thing, which is most important, is he went to the city place to get medication, and that person died. He was my grandfather.
Oh.
The thing is, it's not that we have a lot of medical officers. Even one person who had even a little knowledge of medical would have survived. And that person who went, the medical officer who went to town is my uncle. So I know what India's route requires. It does not require a very hi-fi hospital, a lot of CT scans machines, a lot of things. No. Simple, basic knowledge of medication, basic knowledge of medicine can help the roots of, because we always think this one is doing, this one is that doing. No, I'm sure we require medication for cancer. Yes, I know that. But at the same time, I need to know why that person, like every day we see, when we go to, like we used to go to school, like we see like LKG, UKG students are coming down. Why? Because fetuses are born dead. Why? So like the basic pain that my father had, so he nurtured me so as to get to doctor. So it's not just me, it's my father and me who had dreamt of being here.
Very good. Like all of, we should give a big hand of applause to him. So every one of you have some instinct to become a doctor. So everyone, some stories will be there. If at all I ask everyone, I think every one of you have some stories which inspire. Like sometimes, like my daughter also becoming a doctor. Why, I asked? Actually, by seeing both of us, both myself and my wife are doctors. So seeing us, she want to become a doctor. Now he became a doctor because he has seen the pain where his grandfather went through. So these sort of the stories will be there. But we have to understand what is our role as a doctor. Can anybody tell about Rudolf Virchow? Who is he? Rudolf Virchow? Pathologist? Sociologist? Yeah, what is a triad? Virchow's triad. Actually, apart Virchow's triad, Adolf Virchow also told one great thing. Actually, doctor is not only a doctor, but is a social doctor, social scientist, and also is a attorney of the poor. So a lot of time, doctors used to be very close to the main policy makers because they are treating the kings or treating the main prime ministers or presidents of the state. So they used to influence the policies. So if at all you look at the modern economics, was also built by a doctor and a French doctor. Actually, he was very influential in nature. He was very close to the French king. So they evolved the economics. So what I'm telling actually as being a doctor, what she was asking us, so what is the role of a doctor? Doctor is not only there to treat the disease or a patient which is coming to him. So our role as a doctor expands above this. So we should not be sitting at the clinic and inviting the patient to come, see and write some medicines and go back and treat them. But as a doctor, we should try to find out why the patients are coming to me. Can we prevent this sort of a disease in the community itself? For that, what we have to do? So these are the questions which we need to pose as a doctors, and we should also make the healthcare available to all. What healthcare for all, what we are thinking today is healthcare for all is the main theme of the topic, which is actually based on which actually this conference is being organized. So what do you mean by healthcare for all? So first of all, as a doctor, we should not be limited to the hospital and a clinic and invite the patient and treat them. But our role expands above the clinic, try to identify the main root cause of the problem and try to address them also. And we are the attorneys of the poor. So we need to make that medication, that surgery, that procedure available to everyone. It is not only responsibility of the policymaker, but as a doctor, we should be able to make this therapy available for everyone. So these are the things where, as a doctor, our role is pivotal in the society. సో అంతమంది చెప్పినట్టు మనం ఏమైనా ఊరికి వెళ్తే ఏమేమి ఉండాలి ఊర్లో అంటే అప్పిచ్చువాడు వైద్యుడు నీరు. తెలుగులో ఒక పోయం ఉండేది. నేను తెలుగు వన్ పోయం ఈజ్ దేర్ విచ్ వేర్ యూ హ్యావ్ టు గో. సో వేర్ ఎవర్ a lender is there, water is there, a doctor is there only you have to go. So our role in the society is immense and our role as a doctor is immense, and we should not be limited ourselves to the clinic or hospital. We should go to the communities, identify the problem, treat them, and also make the treatment available for the people and affordable for the people and accessible for the people. 3 A's I told. One is accessibility, second is availability, third is affordability. In 3 pillars, our role is pivotal. So as a doctor, we should make all these things available to the people. Then only healthcare for all will come. So universal healthcare. What is universal healthcare? Can anybody enlighten me? Like anyone, I think I can ask the girl who's sitting in front of me. What is universal healthcare, Amma? What is universal healthcare? You can tell what is there. It's not an exam. I'll not fail you. It's not an exam, no? You're just trying to, I just want to know what do you mean by universal health care? Can anybody give a mic to her, please? Yeah, you can tell. Anybody, I think you're audible. And your voice should be audible to the entire hall without mic. What do you mean by universal health care?
So universal healthcare is healthcare for all, where it's accessible, affordable, and available for all.
Whatever I told, immediately she repeated. So actually you're right. So there are 3 main pillars I like to tell you for what is universal healthcare is. Actually, the 3 main pillars are, if at all you imagine a cube, in one axis, other axis and other axis, 3 axes are there. In the one pillar, you have population which is covered. So how many percentage of the population are covered by you? You means the government. If at all you are a government, you are trying to give a healthcare to the people. When if at all the population 100% coverage is there or not, that is one issue. That is one pillar. So the healthcare should be made available to all the population. Second pillar is what? Services which are made available. Population available, I'll give an example. So let us say like a patient is coming from Basti from Hyderabad, or some patient is residing some area in Adilabad. So all these pockets, not only the people who are residing in Banjara Hills and other people should be made accessible, or health is available for them, but all the population, remote of the population or underprivileged population also should be provided the health. That is known as 100% coverage. So coverage is one pillar. In universal health coverage, you should understand that we should make our health available to the 100% of the population. Means those who are underserved or under developed areas that are residing should be make this health is available. So a remote part of the state, like I'll give an example in Adilabad or in Utnur or in Asifabad or Kottagudam, where tribal areas are there, where health should also be made available for them. Or in Hyderabad itself, if at all you go into buses, some population are not accessing the health care. We should proactively go and give health. That is population coverage. So one angle of the cube is population coverage. Second angle is services available. What services by me? What do you mean by what? So you have different services. You can be outpatient service, it can be inpatient service, or some different pillars of service are there, like a promotive service, a preventive service, a curative service, a rehabilitative service. So, and palliative service. What are the types of services? 5 types. Repeat, doctor. Promotive, health promotion. Before any problem happens, you improve your health. That is known as health promotion. You are not diseased, but you are doing running, jogging, you are dieting. That is actually you are doing a health promotive activity. Second is preventive. What do you mean by preventive activity? So you are at risk, like you are diabetic or hypertensive. Then you are trying to check yourself for kidney problem or heart problem. That is known as preventive service. Curative service means if at all you are already having some kidney failure, you are getting dialysis. That is curative. Rehabilitative. Rehabilitative means actually whenever patient is coming out of the cure, sometime you do a surgery. Is not normal, but is in a rehabilitative phase where you assist him with rehabilitation. Fifth is palliative. When no cure is there, but still you have to do care for them, like cancer, palliative cancer, where disseminated cancer is there, only you have to do a palliative care. So what are the types of care that is available, doctor, again?
Promotive, preventive.
Promotive care.
Preventive care.
Next.
Curative
care.
Palliative and rehabilitative. And
very good. So 5 types. Repeat, doctor, you are in the back again. What are the 5 types of services I told? Promotive. Number 1 is promotion, health promotion. Second is health prevention. Next is health curative care. Fourth is rehabilitative. Fifth is palliative care. So if at all the governments across the world are able to provide all these services, all the types of services being offered to the people. I said initially the one angle is coverage angle, coverage of the population. If 100% of the population is covered, is tick. Other things, services covered. What are the services I told? In this service only you can have OP care, you can have IP care, you can have rehabilitative, so many things. And the third angle is cost coverage. I mean, to provide all these things, you need to have a financial burden to the population. If at all they want to access promotive care, they want to access preventive care, they want to access curative care, they want to access the rehabilitative care or palliative care, everything involves money. To organize this conference also money is involved. So everything that money angle is also should be taken care. So all 3, if at all being taken care for the population, population covered is one axis, services covered is an axis, other axis is cost coverage. So if 3 things are covered to any population, any society, that is known as universal health coverage. If at all in our state, if at all 100% of the population is covered, what is the population of our state, doctor? Anybody can tell? I don't want, because you are all postprandial, I know. Postprandial, anyway, what happens? Your cerebellum will comes down because blood supply is being pumped to your stomach because you eaten. So I want to stimulate you. That's why I'm having interactive session. So what is the population of our country? Is the most populous state in the world is now India. It has crossed more than 130 crores. Our population of our state is 4 crores. How many families are there in our state? 1 crore families are there. If at all one family equivalent to 4, around 1 crore families are there. So our aim is to cover 1 crore families. If at all we are covering 1 crore families, that one angle is over. services covered. But 1 crore families, they are located in different areas. Some families are located in Hyderabad, where you can cover easily, and some located in Warangal, there also you can provide easily. Some are in Khammam, where you can provide easily. But what about in areas where in tribal areas are there, some remote areas are there? There also we should be able to provide the services by establishing the infrastructure there, by providing the infrastructure. He told actually building big hospitals may not be required, but smaller hospitals, a preventive healthcare, health and wellness centers, or a preventive primary health centers, or a sub-centers, and a community health center. So these are the different types of centers are there. What is Board's committee? Anybody can talk about a Board committee? We are all third or fourth SPM. Anybody read about Board committee recommendation? Bohr, not Niels Bohr. Niels Bohr. Who is Niels Bohr?
Scientist.
He is a physicist. What is Bohr committee? Bohr committee is a committee which is recommended for 3-tier system. What is 3-tier system in the country healthcare delivery? One is primary health, secondary health, and tertiary health. So these are the 3-type system which is recommended by Bohr in 1942. When our India was born, or before born of India, this committee recommended that actually India should have 3 types of care. Primary care, which is located in the rural areas, and also in the urban areas were forgotten at that time. They thought actually urban is covered by the medical colleges. But later the secondary care is there. Other is third, tertiary care. But now what happened, actually before primary care, we have one more care. Pre-primary care, like establishing health and wellness center. Before a person becomes a diseased, we are establishing health and wellness centers below the primary health center. So one more level that is achieved is above the tertiary care, what is known as quaternary care, where we do organ transplantation, like in NIMS, organ transplant you are doing, some high-end procedures you are doing, that is known as quaternary care. From 3-tier system, now country is envisaging a 5-tier system now. One tier is added down, that is pre-primary, and other one more tier is added above, that is known as quaternary care. So these are the types of care where country evolved over a period of 75 years. Our country achieved the health independence after 75 years of the country's journey. Now country is achieving this sort of a journey of the system. And one more thing, why more doctors are being produced? The madam was also, somebody was asking to madam, why more medical colleges are required? So what is in generally required doctor to population ratio? Anybody else? Second row. What is the population of the doctors are required to serve, let us say, 1,000 population? How many nurses are required? How many paramedicals are required? Second row. No negative answer. You not be failed. You can guess, no? Doctor with the specs in the second row. Yeah.
According to statistics, we need at least one doctor
Very
per
good.
1,000.
100 marks to her. What is your name, Amma?
Ishita, sir.
Excellent. So 1 per 1,000 is the normal norm. So 1 per 1,000 production is required, and if at all nurses are there, 3 per 1,000 population is required. So this is the norm actually in the established by WHO and other things. So to produce so many doctors, we need more medical colleges. In medical colleges, sit down, Amma. Medical colleges at district level is not only required for production of the doctors, actually to improve the healthcare service also. Don't imagine that by having a college doesn't mean that we are only teaching you. You're also serving the society. You're also taking care of the patients. So our education, medical education is entirely different from routine education. Routine education, you go and study. But we don't do that, no? We take care of the patient from 3rd year onwards. Now I think NMC changed. Now 1st year onwards, madam, if at all I'm wrong, be corrected. Immediately you are able to adopt the society and you are able to take care and directly coming into the societal interaction. So establishing a medical college improve the health care of the district also. So establishing a district medical college is a policy of the government of India and the state governments, so that actually they want to reach the masses, so that actually healthcare delivery, health for all, whatever is written here, is made possible. Nothing happens in a day. It will happen in over a course of time. We have passed after independence, 75 years is over now. So we are progressing towards the further more. So a lot of parameters are improved. After independence, our parameters improved much better. Our maternal mortality came down, our infant mortality came down. These are the parameters through which actually we judge the healthcare delivery of any country. So our parameters are improving a lot in the terms of maternal mortality reduction, infant mortality reduction, doctor to population ratio, all this is improving. Why? Because we want to provide healthcare for all. So this healthcare for all is not a slogan. We are not here to give slogans. We are here to make it happen. So all of you are part of it. Healthcare for all is a political notion or a slogan given by the country or a WHO. In 2023, actually, in the UN meeting, what is known as United Nations meeting, they adopted a resolution to have a universal healthcare by 2030. UHC by 2030 is a political declaration made by all heads of the state who are the part of the United Nations, including our country. By 2030, they want to make the universal healthcare in the entire globe. So for that, actually, our country also adopted and signed. Our state is also in that way. So the UN Declaration of 2030 is one way. So in that major ambition, all you are being produced because you are also stakeholder, you are also the major deliverer of the healthcare. So because of that thirst, the number of doctor population is being produced or increased, because of which you are had an opportunity to become a doctor, and you should be very thankful for the entire society to make you a doctor. She wants me to ask a question, but I'm bombarding with this. So excuse me. So I'll try to tell. After that, you can ask me. So
యా అర్థమైపోయింది సార్ మీరు టీచ్ చేయడానికి వచ్చారు ఈరోజు మొత్తం స్టూడెంట్స్ అందుకే అంతా చాలా ఇంట్రెస్టింగ్గా చూస్తున్నారు
yes, they should be interesting. I am because they are all our
ఇంకా
students.
చాలా మాట్లాడాలి ఉంది కానీ ఇంకా చాలా సెషన్స్ ఉన్నాయి సో
Yes.
యాక్చువల్గా ఏంటంటే చాలా ప్లేసెస్ నుంచి కూడా వీళ్ళు వచ్చున్నారు ఫ్యూచర్లో మంచి డాక్టర్స్ అవ్వాలి
Yeah.
వాళ్ళకి చాలా మంచి సజెషన్స్ ఇచ్చారు మీరు థ్యాంక్ యూ సో మచ్
Yeah, thank
థ్యాంక్
you.
యూ సార్
బట్ నేను చెప్పేదంటే ఇది నాట్ ఏ క్లాస్ కైండ్ ఆఫ్ థింగ్. ప్లీజ్ రీడ్ అబౌట్ యూనివర్సల్ హెల్త్ కేర్ డిక్లరేషన్ విచ్ అవైలబుల్ ఇన్ ది ఇంటర్నెట్. ప్లీజ్ గో త్రూ ఇంటర్నెట్ అండ్ సీ UHC 2030. There is website is there. Go through that. Please read it because you are going to be part of that entire bigger ambit. So please be part and feel responsible as a doctor in the community and be a proactive doctor. Be a social doctor, attorney of the poor. So you are the main person who will take care of all the problem and you are going to solve the problems in the society. If you believe in you, you do it. So that is my message. Please do it and we are all proud of you. Thank you very much.